Good morning again, everyone, and all protocols observed. So yes, I am going into part 2 of last week's presentation, which was requested, I will say by who, on dry eyes. And so we're going to pick up for this week. So here's a question that many people ask. How do they know if they have dry eyes versus allergies? So I want you to note, allergies can contribute to someone having dry eyes. Remember that. And while these two conditions share some similarities in symptoms, allergies are seasonal and they're triggered by allergens like pollen, some people with pets, different environmental things can actually trigger that. And while it is not recommended to aggressively rub your eyes, if you get relief from gently just rubbing your eyes, it's likely dry eyes that you have. If you don't get relief, then it's likely allergies, because that will persist and keep going on. You'll start sneezing and you'll have a lot more symptoms going on, okay? So please remember, get your eyes checked. Do not self-diagnose as if the person want to use, because if you use the drops that is designated for dry eyes or allergies in your dry eyes, then you just make your dry eyes worse. So please don't do that. Someone asked that question, so I wanted to make sure that I cleared that up this week with you. So testing and diagnosing dry eyes. There are no single tests that diagnose dry eyes. Rather, providers may use many tests, including what's called a slit lamp exam, a Schirmer's test, and a tear breakup time test. And you can look on the screen and you can see the different definitions. I don't want to hold everybody up by reading everything word for word, okay? But one of the tests that I want to read definitely is a tear breakup time test. And this test checks how quickly your tears evaporate. The provider puts a dye into your eye and uses a microscope to see how long your tear film remains stable. It doesn't break up. They measure the amount of time between your last blink and when the first dry area shows up on your cornea. A time of fewer than 10 seconds can signal dry eye disease, okay? Healthcare providers also may order other tests, such as antibody tests, to check for underlying conditions that could be causing your dry eye. So management and treatment of dry eyes. The goals of dry eye treatment include easing your symptoms and soothing your eyes, helping you see clearly, minimizing or avoiding damage to the surface of your eyes, and treating the underlying cause. Your provider may suggest you start with home remedies, especially if your symptoms are mild. Avoid environmental triggers. Use a humidifier in your bedroom. Place a warm compress over your eyes for no more than 10 minutes. Give your eye a rest. Practicing what's called the 20-20-20 rule may help. Every 20 minutes, stop and focus your eyes on something 20 feet away for 20 seconds. Also, while reading or using screens, try to remember to blink often to help your tear production. Some people take omega-3 fatty acid supplements. Some research shows that these supplements may support tear production and help your symptoms. In office. So your provider can perform in-office procedures to help your dry eye. Some common options include what's called a thermal pulsation therapy, intense pulse light therapy. Now, therapeutic contact lenses as well is also an option. Dry eye disease can make a simple act of blinking very painful. That's because the eyelid rub against the dry eyes, irritating the surface of your eyes. So therapeutic contact lenses can help by protecting and lubricating the surface of your eye. These lenses come in several forms, including soft bandage lenses, rigid scleral lenses. Your provider will discuss the different contact lenses options. So please make sure you speak to your provider before going out and trying to get these. Management continues. There are many types of there are many types of eye drops your provider may recommend. So you want to talk to your provider about the options that is best for you. Don't use other people's eye drops if the doctor did not recommend that for you, okay? So you have artificial tears. There are ointments. If your eyes dry out while you sleep, you can use a thicker lubricant at night, such as an ointment. Restasis, eye drops treat inflammation in your tear glands, so they produce more and better quality tears. And they have what's called lifitegrast eye drops, varenicline nasal spray, and autologous serum drops as well are also options. So can someone reduce their risk of dry eye? Dry eye disease has many causes, so it can be hard to prevent. You may be able to reduce your risk by visiting a healthcare provider for yearly checkups. A primary care physician can help you with your overall health. If you're concerned about developing dry eye, talk to your provider. Ask if anything in your medical history or medication list puts you at risk, and ask what you can do to lower that risk. Managing underlying conditions. Many different conditions, as I've discussed last week, including diabetes, can lead to dry eye. So you want to talk to your provider about your risks for diabetes and follow their advice for managing your blood sugar levels. Making lifestyle and environmental changes. There are lots you can do in your daily life to lower your risk of dry eyes. If you use a computer daily, take frequent breaks. Avoid cigarette smoke. Add a humidifier, as I discussed previously, to your bedroom and other rooms where you spend a lot of time. Plus, ask a provider for other suggestions to help keep your eyes lubricated and healthy. Statistics, and in conclusion, dry eye disease is common. Research estimates that in the US alone, 16 million people in the US have dry eye. Around the world, dry eye affects tens of millions of people. It's more common in Asia compared to North America and Europe. It is also more common among people who have gone through menopause. Dry eye disease can affect much more than the comfort of your eyes. If it can affect your ability to work, socialize, and enjoy life. Dry eye can take a toll on your emotions and your mental health too. You may feel isolated, but you're not alone. Connect with others who have this condition and any other medical condition, actually, and share your experiences. It takes patience and perseverance, but it's definitely possible to find relief. Your provider will decide which treatments are most appropriate for you based on the severity of your symptoms and any underlying conditions you have. You may need to try many different treatments before finding a solution that works best for you. If your current treatments aren't working, don't hesitate to reach out to your provider. Tell them how you're feeling and ask what other treatments are available to manage your conditions and restore your quality of life. And this does not only go for dry eyes, but with any medical condition. If you have dry eye, it's important to establish care with an ophthalmologist or an optometrist to manage your condition. I want to give special acknowledgement to Healthline, the Mayo Clinic, Cleveland Clinic, and Medical Optometry America for the information I've provided you for between last week and this week. I hope this was helpful, especially for the person that really needed this information. God bless you. Should you have any questions, please join me in the Zoom room immediately after service, and I'll be happy to answer them for you. That is not only on dry eyes, but on any medical conditions. If I don't know, I'll get the information back to you. God bless and enjoy the rest of the service.